the parliament has been dissolved because of elections. So I can confirm, Honorable Chair, that we have a quorum to proceed. Thank you.
Thank you very much, Committee Secretary. Honorable members, at this point in time, we are going to move on to the adoption of the agenda of the day. I don't know how we can have it projected here, Committee Secretary, so that we can be able to review the agenda item by item. For honorable members using the other languages, we do have the agenda circulated through our emails. So we can please open that. And then we are going to review the agenda item by item just to make sure that we believe it does cover everything that we want to talk about today. And any recommendations for amendments to the agenda would be welcome at this point in time. The first part, honorable members, of the agenda today, as we said, the committee secretary has presented the credentials and apologies of the delegates. So we are at the point where we adopt the agenda. There will be welcome remarks by the chairperson of the committee. There will be consideration of minutes of the previous committee meeting, and I already realize an error there where instead of DGHR, we are going to be reviewing the minutes of the HSDSP committee. So that is an edit that has to be done on that on the agenda. We are going to be looking at matters arising from the minutes and presentations of decisions and action taken metrics from the previous meetings. Then at 11 to 11:20, if time does allow, we are going to have a tea break, after which we will come back and have presentations from the SADC Secretariat on the protocols that have been allocated to this particular committee. We'll be looking at 3 protocols, which will be SADC Protocol on Health, Strategy for Sexual Reproductive Health and Rights in the SADC region for 2019 to 2030. We'll also be looking at the SADC Protocol on Employment and Labor. After that, we'll be heading for lunch, which will be coming back afterwards to look into the update on the status of the selected sector-specific protocols. The ones I've already mentioned, we'll be looking at the status of those protocols. We'll then have a health break, a short health break, after which then we'll come back. I'm looking at the timing as well. The times don't seem to be corresponding quite well. If we are talking about health break happening at 15:30 to 1600, it's not possible then to have an item coming after that at 15:50. So that should be also edited there, just to have a clear flow of time. So after the health break, we're going to have an update on the status of the sector-specific protocols as well, which continues from before the break. And that will likely be the end of the day. So if we are able to keep time, honorable members, we are likely to finish the agenda for today. And then tomorrow, we are going to continue on the deliberations on strategies to enhance parliamentary advocacy on the ratification, accession, domestication, and implementation of the SADC protocols. And we will be looking at the review advocacy roles for MPs. We'll be developing concrete action-oriented strategies and formulating recommendations for the 58th Plenary Assembly. We'll then, like always, have some health breaks in between, after which then we'll be deliberating on strategies to enhance parliamentary advocacy on the ratification, accession, domestication, and implementation of the SADC protocols. Doing the same, it will be the continuation of the activity before the health break. We'll have our lunch break, presumably at 1 p.m. to 2 p.m. And then we'll again continue with the same agenda after lunch. Later on in the afternoon, we'll be looking at the post-evaluation assessment on the regional integration topics and SADC PF processes by members of parliament to assess the knowledge gained, understanding improved, and perspective enhanced among regional integration topics and SADC PF processes following the standing committee session. So basically, this is after we have gone through all the protocols, learned about the SADC PF processes, we'll just have a post-evaluation at the end of the day, just to assess how members have been able to improving the understanding of the protocols, the understanding of the SADC PF processes, and topics around regional integration. And after which then we'll close the day with the closing remarks from the chairperson, and we'll be calling that a day around 3:30 p.m. So this is how our agenda stands, honorable members. Apart from the few edits that we have been able to point out, are there any amendments that members would like to effect on this agenda as it stands? I'll go 1, 2, 3. I would assume, honorable members, we are comfortable with the agenda as it stands. So at this point in time, I would call upon one honorable member who would move for the adoption of the agenda, after which we would require another member who will second the adoption of the agenda. Honorable member from Mauritius is moving for the adoption of the agenda. Can we have the seconder? We have the seconder member from Angola. Honorable members, with this, the agenda is therefore duly adopted. At this point in time, honorable members, I will now deliver the opening remarks for the meeting. And then we will then engage the following items on our agenda. Honorable members, good morning. The Vice Chairperson of the committee, Honorable Kareni, who is in absentia. Honorable members of the committee, the Secretary General of the SADC Parliamentary Forum, Her Excellency Ms. Buyamo Sekhuma, our distinguished facilitators and consultants who are joining us today, ladies and gentlemen, may I extend my warm welcome to you all for this critical standing committee session ahead of the 58th plenary assembly. At the outset, it is important to note that we gather today with a shared responsibility of entrenching this committee and ourselves as the legislative engine that drives regional integration and progress for the people. As you are quite well aware, our mandate as the custodians of our nation's commitments require us to look beyond our borders and act decisively within them. In that context, the discussions we will have today will lay the foundation for our decisive actions within our member states. You will recall, honorable members, that on Monday, 27th October, we received comprehensive presentation from the SADC Secretariat, wherein they lamented the slow signing and ratification of protocols. Yet it is quite true and apparent that the progress of our region is inextricably linked to the timeless signing, ratification, domestication, and strategic implementation of these protocols. I do not need to remind you that the substance of these protocols is to improve the human and social development spectrum for the people in the SADC region. Essentially, it is therefore treat to observe that the delay in our governments to sign, to ratify and domesticate these protocols is a damning indictment on our collective efficacy as members of parliament, particularly the domestication process in itself. Part of the legislative mandate that we as members of parliament are enjoined to discharge effectively. It is the mechanism through which regional promises become national realities. When this process stalls, we as the committee and as a regional bloc must look inwards and ask, have we used every tool at our disposal to break this logjam? Honorable members, this is why our agenda today is not only timely, but it is essential. We move from the general lament to specific actionable focus on the protocols that demand our immediate attention. Firstly, the SADC Protocol on Health of 1999 is a foundational text that now requires urgent modernization to meet 21st century health threats. Secondly, the SADC Strategy for Sexual and Reproductive Health and Rights of 2019 to 2030 is a vital, time-bound commitment to health and rights of women and youth, where implementation is lagging dangerously behind the ambition. Third and finally, we are also going to consider the SADC Protocol on Employment and Labor of 2025, which is a forward-looking framework for the future of work, whose success depends on our proactive and swift legislative action. As such, today we are called upon to dissect the status of each of these protocols. We will deliberate on powerful strategies to enhance our parliamentary advocacy, and we will forge concrete, unanimous recommendations to present to the 58th Plenary Assembly. Simply put, our task is to ensure that this committee becomes the catalyst that moves these critical agreements from the shelves of ministries to the statute books of our respective member states, and ultimately into the improved lives of the people we serve. Honorable members, I must emphasize that knowing the status is not enough. We must now deliberate on how we, as parliamentarians, can effectively advocate for these agendas. It is my considered view that to do this effectively, we must focus our strategies on three key pillars. The first being the power of the press, which is our most potent tool. We must move from passive approval of line or program items to active evidence-based budgeting. This means holding pre-budget hearings with ministries to demand specific funding allocation for SRHR strategy and the domestication of the labor protocol. We must fund our commitments, honorable members. The second pillar is oversight with impact, acknowledging that we must transform our oversight functions from retrospective reviews to proactive engagements. We can do this through instituting biannual progress hearings, summoning ministers and department heads to present concrete data on protocol implementation. Building public will anchored on the irrefutable observations that these protocols are about the lives of our citizens. We must use our platforms in our constituencies, in the media, in the public forums to translate these complex documents into tangible benefits. We must build a broad-based coalition of support that includes civil society, the private sector, and community leaders. Honorable members, in concluding, I must reiterate that the protocols are covenant of cooperation, blueprints for a better, more integrated, and more equitable Southern Africa. The health of our people, the rights of our women and youth, and the labor future of our workforce are the very essence of sustainable development and national stability. Let us not be the generation that identified the challenges but failed to act. Let us be the committee and the regional parliament that moved with purpose, used its power wisely, and delivered one of the regional promises we have made. With these few remarks, I officially welcome and open this meeting with the hope that your usual robust deliberations will indeed motivate towards the full and effective ratification and domestication of these regional protocols. Honorable members, with all this said, I thank you and I declare the meeting officially opened. Thank you very much, honorable members. At this point in time, we are now going to consider the minutes of our previous HSDP meeting that was held on the 23rd of April 2025 before our 57th plenary. The meeting was held here in Johannesburg at Premier Hotel, the very same place we are at. So we are going to be considering the minutes item by item to accommodate any variations in the paging on the different languages, because we have the document in 3 languages, English, French, and Portuguese. So given that the language may not have the same, writing, the pages may vary. So we are going to project the minutes here, and then we'll be going item by item such that those who have a different language, they can also follow along with us. Honorable members, the first items to look at would be the attendees who were present, members who were present during the meeting. As we can see, we had 10 members who were present, including the chairperson. Angola was present virtually. We had Botswana present. We had DRC, Eswatini, Madagascar, Malawi, Seychelles, South Africa, and Tanzania. We received apologies from Zambia, Zimbabwe, through our vice chairperson. We did not have Namibia, who had not constituted the committee yet. Mauritius at the same time as well, they had not yet constituted the delegation that will be joining us. Mozambique as well had not yet constituted the committee. Let's go down. We had the support staff from the secretariat. We had our resource persons. I'm sure if the paging, yes. We had the resource persons from Southern Africa Litigation Center. Yes, can you go? We had Arasa, Namibia. Yes, those basically are the members that were with us at that particular time. In the beginning of the meeting, the credentials of delegates were presented, which then showed that those who were in attendance and those who gave apologies. We went through the adoption of the agenda of the previous meeting before then. Just keep going. And other members, do let me know if there is anything that you observe that perhaps needs to be addressed as we move on. I see there is a hand. Yes.
Chair, not an honorable member, just an observer. But I was in attendance as a resource person alongside Salk and Michaela.
I remember that. Please have that noted, committee secretary. I remember you were in attendance and you did actually do presentations. So that should be looked at. Yes. So we had the welcome remarks from the chairperson or members. You can just browse a little bit through what was covered during the chairperson remarks. Most definitely, there may not be much of the changes, because that is really taken from my speech during the opening remarks. So it's just summarized there in the report. So you'll likely have much more comment maybe on the deliberations as you actively participated in that. Yeah. So the next item was consideration of the minutes of the previous meeting, which yes, I'm looking at the dates here. The dates don't seem right. That should be 2024 instead of 2025. There was a meeting held on the 19th and 20th of September 2024. So those were the minutes that we were reviewing during the meeting on April 2025. So that will be edited. So the minutes were reviewed and adopted without any objections. Then we had matters arising. Can you scroll? Yes, just have the table open. Okay. Yeah. Okay. I think it's not showing quite well. Yeah, let's have it that way. So yeah, we had the matters arising from the previous meeting that were then presented during the meeting. Just have a minute to have a look at that and just remember if this is like an accurate record of what you remember us dealing with. But again, the expectation is that you may have had time to look through this, and if you don't have any objections, then we will slowly move on to the next item. And I would really urge honorable members that every time we have this kind of sittings, when these documents are shared with us days before, let's take time to review them so that during this time, that's not when we are very, we are putting too much attention. We should have already reviewed, and if you had some issues, you are able to raise them during this time so that we don't find ourselves spending a lot of time trying to review the minutes now. So can we slowly pass on to the next agenda item? Yeah, can you just pass to the next one? Oh yeah, it's slow. Yeah. So we are realizing that there is some delayed response from the other end. So the next part of the minutes was the presentation on the proposed model law on prison oversight. We had a resource person who took us through the health and prison sector in the SADC region, and that was Ms. Clayton from ARASA, who generally spoke about issues within the prison, issues of TB and HIV infections that seem to be a big issue within our prisons. Talked about the TB and HIV treatment protocols that need to then be integrated as we are working on the model law on prison oversight. So those were the issues: the sexual violence and transmission of diseases that happen within the prison premises. So generally, it was really making us understand the conditions of our prisons within the SADC region, the statistics around how many prisoners do we have, the congestions and all the challenges that need to be addressed by the model law oversight, the oversight model law on prisons. So yes, that was it. Let's move on to the next. So we also had another expert presentation on the importance of prison oversight in protecting the prisoners' rights to health. And as mentioned, really, the meeting was all about, discussing the model law on the prison oversight. So we looked a lot into the conditions and situations that prisoners are undergoing, and what are some of the critical things that the model law should look into when we want to play oversight on prisons. So the expert presentations really were trying to bring us to speed and understanding of the fact that even if people are incarcerated, they still have right to access to health. And how do we ensure that they do receive that level of care that is required by law, and making sure that we protect their human rights, regardless of whether they are in prison. So these are some of the things that were being discussed during the meeting. Yeah. Next. Delayed on my end. Yeah. Okay. We also had an opportunity really to watch some of the videos of some correctional services across different African countries, really to appreciate and understand the situations with which the incarcerated actually are enduring, and then looking at what are some of the improvements that the model law should be looking to effect. And, we looked at videos for correctional services in Malawi, for example, looked at the terrible situations that people live in. And then, that kind of helped us really to understand what the spirit of the model law is about, and how then do we help to improve situations and circumstances within the correction facilities. Because at the end of the day, I think the agreement across during the entire meeting was we really want to transform our correctional services to being rehabilitation centers instead of necessarily being prisons where people are being punished. We have an understanding that good prison health translates to good community health, because the people who are within prisons will one day be out of prisons, integrate back into our communities. So it is important that we ensure that when they do so, they are in a better mental and health state, that they will not then make our communities more vulnerable. So our focus on this model law really was, how then do we make sure that during their time in prison, we actually provide them with sufficient rehabilitation, such that when they reintegrate to our communities, it is not a risk to our community, but much more of a reinforcement of our community. So these are things that we really were discussing during this presentation, and the videos were just to make us understand what the current situation in different countries look like, and perhaps how they can be addressed. Yeah. So next, we are going to move to community deliberations and recommendations. And again, honorable members, this is quite a long section as well, and I would assume that you had time to look through it. But I think, just go up, I'll just read some of the recommendations. Yeah, I think I'll just read the recommendations here. Take it up a bit. Oh, yeah, so some of the recommendations that the committee made to the 57th Plenary Assembly were to urge the national parliaments to strengthen the capacity of oversight committees to monitor conditions and enforce compliance with healthcare standards and investigate abuses with mandatory public reporting within prisons. Another recommendation was encouraging member states to integrate prison health services into national public health systems, ensuring access to TB/HIV programs, mental health care, maternal health services funded through domestic budgets aligned with the Abuja Declaration of 15% health allocation. There was a recommendation to support the adoption of the independent monitoring mechanisms, including oversight visits by parliamentary committees, national human rights institutions, and civil society, with safeguards for whistleblowers and detainees. There was a recommendation to urge SADC Parliamentary Forum Secretariat to develop regional prison health benchmarks, including minimum standards for medical care, for staff training, and data sharing between prisons and public health authorities to track disease outbreaks. So these are some of the recommendations that came out of that meeting that were then taken to the 57th plenary. So you can move to the other section. Honourable members, this was then took us to the end of the meeting where the chairperson had the closing remarks. And in the closing remarks, really, the chairperson expressed the gratitude to all members, both in person and those who were online, and our resource persons who presented quite valuable information and insights to the committee. And that, honourable members, was everything that was done in the review of the minutes of the previous meeting. With this, honourable members, I would ask one honourable member if there are no suggestion of amendments to move for the adoption of the minutes, and then we will have another second honourable member who will second that. Honourable member from Angola moves for the adoption of the minutes. Can we have honourable member from Mozambique moves for the secondment of the adoption of the minutes of the previous meeting? With that said, honourable members, the minutes have been duly adopted. At this point in time, honourable members, we are going to now consider matters arising from the previous meeting. We will kindly be looking at the action taken matrix within the documents that were shared with us, that was prepared by the Secretariat. We shall consider the issues in the action taken matrix item by item. In this regard, I will invite our committee secretary to present the updates contained in the action taken matrix for consideration item by item, so that we have all members following from different languages. Thank you.
Thank you, Honorable Chair. And honorable members, I'll take you through the decisions and action taken matrix following the meeting held on the 23rd of April 2025. Mic is off. It's muted. It's muted.
Yeah, can you speak?
Yeah. So I can continue.
Yeah, it's on. It was
okay. Okay. So the first resolution, honorable members, and for the benefit of honorable members who have joined the committee, the decisions and action taken matrix is really a compilation of the recommendations that the committee presents to the plenary assembly. So in this case, we compiled the recommendations that were presented by the honorable chairperson as part of the minutes of the previous meeting. So we compiled them, and for the purposes of giving you updates on what actions the SADC PF has done or national parliaments have done in order to ensure that these recommendations are actioned or implemented. So the first recommendation, honorable members, was to encourage member states to integrate prison health services into national public health systems, ensuring access to TB or HIV and HIV programs, mental health care, and maternal services funded through domestic budgets aligned with the Abuja Declaration's 15% health allocation target. And the status, honorable members, is that it is ongoing, primarily because the SADC PF, as part of the process of developing the model law on Prison Oversight engaged the relevant ministries, departments, and agencies of government and alerted them of the need to ensure that prison health services are really integrated into national budgets. And again, the second recommendation was to support the adoption of independent monitoring mechanisms, including oversight visits by parliamentary committees, national human rights institutions, and civil society with safeguards for whistleblowers and detainees. And this process is also ongoing. And the status of this process is that following the plenary decision, the Secretariat also established a model lawmaking is undergoing through the process of establishing a model law. So to do that, we engaged the legal drafter from the Southern Africa Litigation Center to support the development of this model law on prison oversight. So the drafter has since prepared a policy position paper, which was considered by the joint sitting of committees in April 2025. So there's currently broad-based consultations with various stakeholders to ensure ownership, inclusivity, and legitimacy of the process. So the draft will be subsequently proceed through established stages, culminating in its validation by the joint sitting of committees and eventual approval of the plenary assembly. And you may wish to know that for most countries, speakers of parliament were quite active in these public consultations. And I recall the speaker from Angola, and if I'm not mistaken, Mozambique as well, Zimbabwe, Zambia, they also Mauritius. The deputy speaker from Mauritius was also a key a participant in these public consultations. So it is also quite important that if you have any observations that you have pertaining to this process, you can also share them with the Secretariat. And then the third recommendation was to urge SADC PF Secretariat to develop regional prison health benchmarks, including minimum standards for medical care, staff training, and data sharing between prisons and public health authorities to track disease outbreaks. And it's again a process which is ongoing as like I mentioned earlier, the SADC PF has engaged a consultant to develop this model law, and which will provide, among other things, the minimum standards for medical care, staff training, and data sharing between prison health authorities to track disease outbreaks. And then we also called upon national parliaments to prioritize gender-sensitive healthcare in prisons, including SRH services for women and trauma-informed care for juveniles, as required under the Bangkok Rules and Nelson Mandela Rules. And this recommendation came from the observation made by members of parliament and the judges and other stakeholders that our prison systems were really gender insensitive. And an example was given of toilets in one of the countries in the region where it is shared by up to 50 women. So the idea here is to provide to prioritize gender-sensitive healthcare in the prison, and the process again is ongoing. And where some speakers of parliament were really active in the public consultations, and they reiterated the need for gender sensitivity healthcare services in prisons. And then another recommendation was to encourage member states to invest in prison healthcare infrastructure, including clinics, isolation units for infectious diseases, and rehabilitation programs funded through innovative financing like earmarked taxes for tobacco, alcohol, or reallocated security budgets. And again, the model law, which is under development, has also encouraged member states to invest in the improvement of prison healthcare infrastructure. So it is certain provisions that provides for the need encourages member states to really focus on ensuring that their infrastructure is cognizant of the agenda and the goal for rehabilitation, to move away from rehabilitation, from punitive penal codes to rehabilitative prison systems. And then to also urge the Secretariat, SADC PF Secretariat, to collaborate with various regional international bodies to facilitate cross-border and south-to-south learning on prison health, and including food procurement of medicines, shared training for medical staff, and regional fora to exchange best practices. And again, it is a process which is ongoing, where the model law process is also a collaborative effort between the forum, national parliaments, and other stakeholders, including those in the civil society, including formerly incarcerated persons, so that the key provisions in the model law address the fundamentals or the latent spirit of this recommendation. And then we also the committee also strongly encouraged national parliaments to effectively discharge their oversight mandate to ensure that governments reduce pre-trial detention rates through legal reforms and alternative sentencing, alleviating overcrowding that fuels the health crisis. It was also this resolution for the benefit of members who were not part of the process. It came as a result of the observation by judges and other stakeholders that the prisons were overcrowded. And one of the reasons which were given for the overcrowding was that they were pre-trial detention rates were quite high in most countries, and also our judiciary were really lethargic in instituting legal reforms or alternative sentencing processes. So the forum continues to encourage member parliaments to discharge their oversight mandate on prisons. However, the effective of this rests primarily on you as honorable members to really institute and discharge your oversight mandate, and then encourage parliaments to engage formerly incarcerated individuals in policy design, ensuring reforms address real needs and barriers to reintegration, such as stigma linked to prison-related health conditions. Again, this is a process which is ongoing, and the process through the forum, through the process of developing the model law, also engaged formerly incarcerated individuals to feed the substance of the model law, because we believe the same way as the young people believe that there's nothing for the prisoners or formerly imprisoned persons without them. So the model law development process has been quite inclusive in that process. So, honorable members, I will thank you for this update, for affording me the time to provide you with this update, and I'll give back to you, Honorable Chair. Thank you.
Thank you very much, Committee Secretary. Honorable members, are there any points of clarifications that you may want to get? I think there is something I picked myself on the adoption of the policy paper by the joint sitting. The dates there, the dates that have been put there, I think we need to really look at that, because I believe that was the very same paper we adopted in this joint sitting, right? But the way it's written in the matrix, it's as if the adoption of that policy paper happened in April 2025, but it happened in this joint sitting, October. So I think that should be looked at and corrected. Honorable members, are there any clarifications that you want to seek, or any concerns or contributions? Okay, honorable members, let's then move to our next agenda item. At this point in time, honorable members, now we are getting to the core of our sitting these 2 days, which is reviewing and learning on the SADC protocols. So we have our resource persons with us today from the SADC Secretariat, who I will now hand over the proceedings to him, who will be guiding the process for the rest of the day. Kindly note that after each presentation, we shall have a question and answer session to enable members to seek clarity on immediate issues that you would have presented about, so that it becomes much more of an engaging kind of exercise. Given that we have an evaluation at the end of the day, at the end of the 2 days, where we would really want to seek how much of understanding the honorable members were able to get during their presentations. So, distinguished resource person, I would really want to hand over to you now. I'm not sure if you are going to be connected, because we would love to see your presentations on the projector. Is it possible for you perhaps to come sit a bit forward here so that we can exchange or how can we do it, our tech? Oh, he joins the meeting via Zoom, and then he can present by sharing his screen. Okay, please assist him with that.
What I want to put, sorry, is this one? Okay. Let me see, share. Is it open? Yes, it is open. Which one is it? Can you just see it here? PowerPoint. Yes. This one, right? Okay, so let me just put it in presentation mode. Yes. Okay, you should.
It's just how big it can be. It can be.
Okay, thank you very much, our distinguished guests. Kindly introduce yourself so that honorable members know who you are and where you come from, and then you can now take us through your content. Thank you.
Thank you very much, Honorable Chair, and honorable members of Parliament present here, and colleagues from various organizations. My name is Mike Masie. I am from the SADC Secretariat, from a directorate called Policy Planning and Resource Mobilization. I'm going to take you through this particular thematic discussion relating to social and human development and spatial programs. The purpose of the presentation is to give you some context on how social and human development and spatial programs fits into the SADC common agenda. And then I will go into some of the protocols that have been developed and partially ratified or signed, still waiting to be signed by other member states. And then I will get back to the status of these protocols to indicate where we are and make a few suggestions on what needs to be done. I hope I'm audible and honorable members can hear me. So this is an outline that I'll follow. I'll give a very short overview of the SADC common agenda, and then I'll get straight into the aims of the social and human development and special programs, thematic area, and then present the status of selected protocols which we were asked to discuss, and then I will conclude. So what is the SADC common agenda? This is enshrined in Article 5 of the SADC Treaty, where member states have declared that the objective of the community shall be to promote sustainable and equitable growth and social development, leading to poverty alleviation and subsequently to poverty eradication over the years. They've also committed to enhancing the standard and quality of life of the people in the region. But more crucially, which probably speaks to the thematic area that we will be discussing, or we are discussing today, is the commitment to support the social disadvantaged through regional integration. And then achieving complementarity between the national and the regional strategy. And probably this is why the SADC PF will be very crucial, because whatever is being discussed at this level is considered regional, but then how that cascades to national member states will be very crucial. So members of parliament will have to help us in ensuring that this complementarity is achieved. Now, what are the aims of the social and human development and special programs? The aims are broad, but I will focus on two. First is to enhance the standard and quality of life of the people in the region through human resource development, social welfare, and inclusive growth. And the other aim is to support the SADC common agenda by ensuring that we include in the regional indicative strategic plan programs that are addressing human and social dimensions of regional integration. So you will realize that the HSDSP is a component of the overall strategy that the SADC community has espoused to undertake between 2020 and 2030. Coming to how the aims are going to be realized according to the HSDSP thematic area, and how this is linked to the protocols. First, the SHDSP contributes to the RISD, which is the Regional Indicative Strategic Development Plan. And this is a plan which member states have put together as a mid-term strategy to develop the region. So the SHDSP fits into this particular agenda by enabling a relationship between what is implemented by member states vis-a-vis where the community wants to go. Now, to do that, these aims, the vision, and aspirations have to be implemented somehow, because we have indicated we want to achieve better lives for people. We want to ensure that the disadvantaged are taken care of. Now, to implement that agenda, we need instruments. And this is where the protocols come into place. So the SADC community has agreed to put in place protocols and frameworks to enable member states participate in the implementation of programs for achieving specific objectives that are in the RISD to better the lives of the people as indicated in the common agenda. So in here, we are going to discuss 3 protocols. And these protocols are defined as legally binding documents which have committed member states to the objectives and specific procedures that are stated in these protocols. And for a protocol to enter into force, the requirement under the SADC rules is that 2/3 of the member states have to sign and ratify. And this is where, like we said in the joint meeting, that we are having challenges and problems in ensuring that some of the protocols that we have developed should be implemented, because there is inertia to ratify them, there's inertia to sign them. So if these protocols are not going to be signed, if these frameworks are not going to be ratified, it will be very difficult even for the HSDSP thematic group to achieve what it pronounces itself to. In this particular session, we have been asked to talk about the SADC protocol on health, the strategy for social reproductive health and rights, as well as the SADC protocol on employment and labor. Just to give you a flavor, at the moment, SADC has about 26 protocols, and these include some of them which have not been ratified or signed yet. The HSDSP has several other protocols I need to mention, because when I consider how we've defined SHDSP here, For us in the Secretariat, it also includes things like gender, the youth. But I appreciate that for purposes of the SADC PF, we are going to discuss a SADC protocol on health, the strategy for sexual reproductive health and rights, and the SADC protocol on employment and labor. Let me start with the SADC protocol on health. This was signed in 1999 and came into force in 2004. So what does this protocol aim to achieve? So its objectives are to identify, promote, coordinate, and support activities with potential to improve the health of the population in the region. It also endeavors to coordinate regional efforts on epidemic preparedness, mapping, prevention, control, and eradication of diseases. The other objective is to promote and coordinate the development, education, training, and effective utilization of health personnel and facilities. The SADC protocol on health also endeavors to address health needs of women, children, and other vulnerable groups. These are some of the many objectives of the SADC protocol on health. I've just mentioned those critical ones. So what does the protocol look like? I'm not going to discuss specifics in terms of each of the protocols, but I'll just give you a list of the areas that the protocol addresses. So it has provisions for how health systems must be designed and implemented in the region. It has issues on communicable and non-communicable diseases. It also has issues affecting people or persons with disabilities. It also talks about reproductive health, childhood and adolescent health, some of the things which were discussed in the meetings over the last 2 days. And interestingly, it also has issues pertaining to traditional health practitioners and mental health, environmental health, occupational health, pharmaceuticals, and institutional mechanisms. Now, this is just like a background to what the protocol stands for and areas that it covers. Now, allow me to get into the status of this particular protocol, and I'll ask my colleagues from the IT, because the way I prepared my presentation, I didn't realize that you wanted me to present the protocol, go to the status, and then move to the next. I'd prepared the other way around, but I'll ask my IT colleagues to come and help me to beam the status. Okay. Thank you very much. The Secretariat is kind to allow me to proceed the way I prepared my presentation. So I'll proceed and I'll
consider with this one.
Yeah, it's the same one, so I'll just proceed. Can I have some water? Yes.
So our resource person, just to confirm, we understand what you needed. You were trying to present the protocol, then after presenting it, you wanted to then update us on the status. That's what you were trying to get to, right?
What I wanted to do and align with what I prepared, because when I saw the agenda, I just saw those priority protocols, the 3 of them. So I just wanted to give the objectives of each one of them,
yes,
and the areas that are covered by each one of them. After finishing there, then I would go to the status and discuss the status of each one of them.
Yes, and I think that's how our agenda looks like, because the update of the status of the protocols comes after lunch. So by now, you can actually now present the protocols themselves, and then the status we can see after lunch. Or maybe after you finish, because if the content you prepared for us can finish before lunch, why not?
I was hoping so, Chair.
Thank you.
Thank you. All right. So the next one is the strategy for social reproductive health and rights in the SADC region for the period 2019 to 2030. This particular strategy provides a policy and programming framework so that member states can accelerate the attainment of social and reproductive health and rights for all people living in the SADC region. Now, like we heard in the presentations over the last 2 days or so, it is an area of great interest, and it is an area we all recognize a lot of work needs to be done. And we think that the SADC PF is on the right track to pronounce itself or to commit to this particular area so that we can demystify issues around this particular area and address the real problems that communities are grappling with in relation to SRHR. The vision of this strategy is to ensure that all people in the SADC region enjoy a health, sexual and reproductive life, have sustainable access to services, coverage and quality SRHR services, information and education, and are able to fully realize and exercise their rights with respect to reproductive health rights. And this is an integral part. I want to emphasize, Chair, that this is an integral part of sustainable human development. And the SADC PF is correct, is on the right path to ensure that this particular item is top on the list of its priorities. So what are the strategies that we require to ensure we fast track? Because obviously from the reports that we are given in the meeting, we are really lagging behind, and we need strategies to fast track in this particular area. So there must be innovative leadership that boldly accelerates this SRHR regional agenda. We need also to ensure the alignment of member states' policies and legal frameworks with the global and regional commitments and international human rights standards. At regional level, the SADC PF is clear on what it wants to do in this area. It's very clear what the aspirations are. It's now up to members of parliament and national governments in our respective member states to align themselves to what the region has pronounced itself to. And this is where the role of members of parliament will be very crucial as they go back to their respective countries to ensure that as these things are debated in parliament, as they interact with communities and leaders, church leaders, traditional leaders, that they are able to bring these strategies to these audiences to ensure that we fast track this particular agenda item. But also that universal health coverage and various health systems in member states should incorporate SRHR agendas as they implement health programs. But more crucially, as we saw in that dashboard that was presented yesterday, the monitoring and evaluation of this particular agenda is very key. We need evidence for policy to be designed properly, for programming and service delivery to be in line with what we've espoused as SADC PF and as a region. On the SADC protocol on employment and labor, Chair, I'll be quite quick so that we can quickly get into the status, and I present the critical things that are required by members of parliament to help push these protocols forward. The protocol on employment and labor is relatively new. It's 2025, signed in 2025. We still have issues in terms of ratification. So the objectives of this particular protocol are or include establishing a strategic regional cooperation framework on employment and labor related matters to achieve decent work for all. The protocol talks about promoting inclusive, full and productive employment, particularly for vulnerable groups such as the youth, women, and persons with disabilities. The protocol also aims to promote sustainable enterprises and enhancing labor productivity, output per worker. We acknowledge that output per worker in the region is not encouraging. So this particular protocol speaks to strategies on how we can enhance such. The protocol also talks about facilitating the adoption of minimum labor standards and the realization of fundamental principles and rights at work. These have to do with things like minimum wage, minimum labor conditions, and generally the welfare of workers as they carry out their work in various places. The protocol on employment and labor also talks about promoting equality of treatment and non-discrimination, as well as the elimination of violence and harassment in the workplace. We've got reports of sexual harassments, we've got reports of racial harassment or discrimination in various places of work. So this particular protocol provides for how we can deal with such issues by promoting equality of treatment and non-discrimination. The protocol also talks about promoting the establishment and the effective function of the labor market. This is important for us to achieve one of the objectives of productivity, because we need to have a functioning labor market for people to do the work properly. Last but not least, among the objectives of this particular protocol is the establishment of a labor responsive migration governance system, taking into account regional migration context and capacities of member states. This one is interesting because it also speaks to what the community or the region is currently discussing on movement of people across borders. So this particular protocol spells out some of the strategies that the member states will have to implement in order to achieve labor migration across borders. So, Chair, those are the brief overviews and objectives of the three items on the agenda: the protocol on health, the strategy, as well as the protocol on employment. Now, I'll ask my colleagues from IT to come and help me to beam the matrix on the status.
Thank you very much, resource person. I would kindly request that before we move on to the status, to have some bit of engagement, vulnerable members, perhaps on the protocols themselves, in case there are some clarification, there are some questions, or perhaps some concerns that they would want to raise on the content of the protocols first. And before we move on to the status, I would also make a suggestion to honorable members through indulgence, perhaps to take a moment of a health break in between, so that when we get back to discuss the status, then we can open the possibilities of finishing everything. And when we go for lunch, perhaps we'll have done everything on the agenda for today. So I don't know what you honorable members would say about that. But before we discuss the one of the break in between, I would really open up a floor for honorable members who would want to comment on the protocol themselves, seeking clarity or raising any concerns that they may have. Honorable members, the floor is open for engaging our resource person on the presentations that he has already made. And as honorable members are thinking, I think I had a question that I really wanted to ask on the protocol on health. You did show that it was signed in 1999, but only became effective, I think you said 2004, right?
The one on health?
On health.
Yes, signed in 1999, became
effective
came into force 2004.
2004. Yes. So I just wanted to ask to say, how was this protocol instrumental during the COVID-19 outbreak? Are there any examples perhaps of collective action by the region that were made possible by the existence of this protocol during that time? That is one question that I wanted to ask. The second one would be on the protocol on labor. Can we see it, once it comes to effect, addressing the issue of some radical movements like Operation Dudula, where we see some Africans coming to South Africa being kicked out, who are seeking jobs? Are we going to see it facilitating? You did talk about there is another agenda at SADC level where we are speaking about movements of people and everything. So we are talking about employment and labor here. Will that movement of people also be speaking to the need of people moving from one country to another in search of jobs and creating an environment where it is possible for them to legally work within those countries, such that we don't see ourselves having these kind of issues like Operation Dudula happening? Does it contain any of the solutions to that? I think those are my two questions, and we can then see if other honorable members will add to that. Thank you.
Thank you very much, Honorable Chair. In fact, you are spot on. During the period of the COVID-19, the SADC community relied quite heavily on the protocol on health. First, to coordinate the response in terms of the strategies, because the protocol talks about coordinating responses to epidemics, coordinating responses to diseases, communicable and non-communicable diseases. So this particular protocol was used to convene meetings of sector ministries like health, disaster management, as well as transport, to ensure that the commodities that were needed in many places, particularly the landlocked countries that depend on shipment across coastal line countries, they were able to be assisted through this protocol in coordinating movement of the commodities that were required to address the COVID issue. But also it provided leadership on the continent, agreeing on what interventions the region should adopt in terms of responding to the COVID issue. Because as a community, you realize that chairpersons of the SADC Summit and the SADC Council of Ministers and their respective sector ministerial committees play a very important role in sending the message. So it was a message agreed at regional level, cascaded at national level. So the protocols were similar, such that we didn't have a situation where Mozambique was implementing a different protocol on COVID compared to South Africa or Zambia or Tanzania and others. And because these were built on science generated by the committees of health and the relevant experts. So just to agree and mention here that, yes, this particular protocol was heavily relied upon to ensure that we dealt with the issue of COVID. On the issue of labor migration, yeah, this particular protocol, we hope that when it comes into force, because it is one of the issues it addresses is exactly what you've mentioned, because the region has been grappling with those problems where the youth seeking employment in many other places in the region face some form of discrimination or harassment, and certain unpleasant vices that we've seen. So this particular protocol speaks to member states adopting strategies that will prevent them from doing exactly what you have said. But this protocol alone, this is why I mentioned the other work that is currently going on. This protocol will also be supplemented by what is happening. I know that Botswana and Namibia have signed a memorandum of understanding to allow people to move across borders without requiring visas or permits. So we hope that work can go on for member states to agree that we do no longer need visas and work permits to go and work. I know that for you to go to DRC, for example, from the region, you need a visa, and one other country I can't just remember. So this particular protocol, when enforced, will address, if you are a qualified engineer in South Africa, you must be able to work in another country within the region for work that is required to be done by engineers. So those are some of the things that, if you're a medical doctor, you must be able to work in any country within the region, because this particular protocol says the qualifications for medical doctors, the qualifications for engineers are the same or should be the same. So it's also work that is supposed to be done in others, like protocols on it, if there's protocol on education and others, where we need to standardize education qualifications. We need to ensure that what you get as your degree in one country should apply in another country. So I'm hoping that by the time this protocol comes into force, the issues you've raised will be addressed, and many others which may be hanging out there and we've not yet applied our minds to at the moment. Thank you very much. Yeah.
Thank you very much, no resource person. I realize honorable member from Angola would want to have an intervention. Thank you.
Obrigado, senhor presidente desta sessão. Muito bom dia, ilustres deputados. Eu gostaria de felicitar o nosso preletor por esta...
Honorable member, there is no translation. Can we do it? Can you help us with English translation, please? English translation. Yeah, but it's not coming through.
Okay. Alô? Muito obrigado, senhor presidente. Eu agradeço por me ter dado a palavra. Cumprimento os senhores deputados, muito bom dia. Cumprimento também os nossos facilitadores e desde já felicito o nosso preletor. Eu ouvi na sua intervenção de que o protocolo de saúde foi aprovado em 1999, entrou em vigor em 2004. Sei que existe também um plano estratégico indicativo de desenvolvimento regional da SADC 2020-2030, mas não consegui perceber quantos países da nossa região já assinaram ou ratificaram esse protocolo de saúde. Falou de alguns memorandos que existem, mas eu queria saber concretamente quantos países já aprovaram e ratificaram este protocolo de saúde, que me parece um instrumento muito importante para os nossos países. Essa era a minha questão. Muito obrigado.
Thank you, Honorable Member, for that important question. I guess it was something that I was going to speak to in terms of the status, but I can respond by indicating that there are about 12 countries that have signed the protocol on health, and there are 10 member states that have ratified. The process of getting the protocol into force is like in stages. First, member states have to sign the agreement establishing the protocol, and that is what we call signing the protocol. And this is signed by 12 member states. Then the member states will have to take the signed protocol back to their domestic environment. Some of them ratify them through national assemblies, others decrees. So I'm not too sure exactly how Angola ratifies its protocols. But for purposes of responding, there are 10 member states that have ratified, which means they've taken the protocol to their country and the country has approved. So this is why the protocol is in force, because 2/3 have actually ratified. Thank you very much.
Thank you very much, our resource person, for that. All members, I want to put it before you again. What would you say about us taking a health break and then coming back to the last portion of the presentation, where our resource person is going to take us through the status of these protocols and possibly looking at the time now and perhaps the material that he's to present, we are likely to finish. And then when we go for lunch, we would have finished the agenda for the day. Would that be reasonable, honorable members, that we take a 15-minute break? I think silence means consent. I see people nodding. So all members, let us, it's 11 o'clock right now. Can we reconvene again at 11:15 for us to have a presentation on the updates of the protocols, and then we can see how far it can take us before lunch. Thank you. Honorable members, welcome back from the short break. I hope you had a few minutes to refresh and refocus again. We are going to now hand back to our resource person, who now is going to take us through the second part of his presentation. Is the translation okay? No. Oh, they're not back yet. So translators. Yes, we can hear you. Okay. I'm going to continue. Honorable members, do let me know if the translation is coming through. Honorable member from Angola, is it coming through? Okay. Honorable member from Mozambique. Honorable member from Mauritius. French is coming through. Okay. It seems we are okay. We are set to go, honorable members. So we're going to hand over to our resource person now to take us through the status on the protocols in question, and we'll see how far this will then take us. Thank you very much.
Thank you very much, Honorable Chair and the members of Parliament. I'm now going to present the status on selected sector-specific protocols under the Human and Social Development and Special Programs thematic area. And on the screen, we are seeing the SADC protocol on health. Apologies that the table looks small. I hope we're able to pick one or two from those small writings. So this particular protocol was signed in 1999 and came into force after 2/3 of the 16 member states of SADC ratified. So we still have a number of countries that are yet to ratify, but the good news is that this particular one has been ratified and is in force. Just to recap on what I said earlier, the benefit of this particular protocol is that it helps to strengthen our health systems. It facilitates disease surveillance. It coordinates effort on epidemic preparedness, like I said, on COVID. It also helps in mapping and prevention and control of communicable and non-communicable diseases. Now, the implementation of the protocol on health is quite interesting, because even after ratifying the protocol and having it in force, the health sector still takes this protocol as just one of the guiding documents. And this implementation is mainly done through other frameworks and strategies, including declarations that the member states once in a while put in place. So on the far right, the column on the far right gives us an idea of how this protocol is implemented. So when there is an issue to do with HIV, member states pronounce themselves to this challenge and make a declaration. And once such declaration was made in 2021, a declaration to end HIV, this declaration was made under the protocol on health. Unfortunately, even when we realize that this particular problem of HIV is serious in the region, there are only 3 member states that have signed the declaration out of 16. So 13 have not done so, even when we are aware that the HIV is an issue in the region. The next one is a framework a framework of action for the financing of the health sector. I'm sure honorable members of Parliament present here are aware of the challenges, the fiscal challenges that governments in the SADC region and other regions have been experiencing in terms of financing the health sector. In fact, a very big proportion of health budget in most member states is externally financed. And this is why when the US shifted its policy, its foreign policy, affecting how it supports developing countries, most of them are experiencing difficulties in the health sector. Now, there was a framework of action that was developed on financing the health sector, but its implementation remains a challenge because we are unable to put money into this particular program of action, and therefore our health sector continues to face challenges. So members of Parliament here can help to remind our governments and our executives on the need to ensure that we allocate more resources in this particular area. The next one is I don't know whether your chair would want me to get feedback on this particular one before I move to the next one, because like we can see, the main challenge there is just lack of financing. The protocol is already in force, and some of the declarations and frameworks that have been put in place are not, it looks like, are not fully supported by member states. So it poses a challenge on how we move forward with this particular protocol.
Thank you very much, our resource person. I really think it would be great that honorable members engage you with this particular protocol, so that when you move on to the status of the next, whatever issues and concerns that they have on this particular one, they have been able to raise them and were able to be addressed. Honorable members, let us open the floor to you for your own interventions, questions, clarification points, concerns. As we can see, we have countries that have signed and those that have signed and ratified. Some have not signed, have not ratified. And I think we have one other country that has not either signed nor ratified. If I'm looking at it well, I see Madagascar. It doesn't fall under countries that have signed. It either doesn't fall under countries that have ratified, because most likely will ratify because you signed. Angola did sign, but under countries that have ratified, it isn't there. It is under countries that have acceded. And when you look at the countries that have signed the declaration to end HIV and AIDS, Angola did sign that declaration. So perhaps speaking about these variations, do you have any insights in terms of why, for example, we taking Angola as an example, it acceded to ratification but did not ratify, but it seems to be cooperative. It seems to be wanting to move forward. If it is one of the countries that have signed the declaration to end HIV and AIDS, do you have any idea of what the challenges around the ratification could be? And perhaps the honorable member from Angola as well, if she has something to say to us will let us know on that. And I think the other thing we were expecting at this point in time would be what are some of the recommendations for members of parliament to try to assist in the efforts on trying to advocate for the uptake of these processes that seem to be quite slow. I'm sure that that is going to come in our next presentation, but at this point in time, my view would just be on that one of Angola seems to be very ambitious. It's participating, it's cooperative, but it is not in the part of the ratification. Is there any specific reason for that? Madagascar has agreed to this protocol, but it hasn't signed yet. It hasn't ratified. Do we have any feedback, perhaps, in terms of why or why is this happening? Seychelles, I can see that it's one of the countries that have yes, it has signed the protocol, but has not ratified. It has actually acceded to the ratification. So maybe if you have that information to really tell us what are the circumstances of each of the countries that may not necessarily have not fully completed the process. What are some of the reservations that have been communicated, if any? But if it's something that's not clear on your end as well, members from the member states, if they have any idea, they will say. Otherwise, it's an assignment for us really to go back and try to understand what is stalled in the process. Yeah. Honorable members, if you have anything as well, please, the floor is open. I see honorable member from Mauritius.
Thank you, Chair. And thank you, presenter. So I'd like to comment on the declaration to end HIV. Mauritius is committed to combat HIV and ensure comprehensive care for those affected. We have a national HIV plan 2023-2027, which outlines strategic interventions aimed at ending AIDS by 2030. So we have a consequent budget for 2025-2026, 8.5 billion rupees for the healthcare national budget, with emphasis on the fight against HIV. So maybe I may talk also about the strengthening the National Sexual and Reproductive Health Implementation Plan 2020-2027, which promotes positive sexual and reproductive health across all life stages. This plan emphasizes the importance of comprehensive healthcare services, community awareness, and addressing the needs of vulnerable groups. So lately, we have set up a national working group with a diverse group of stakeholders, with parliamentarians, line ministries, civil society organizations, development partners, and community representatives. So the working group will serve as an engine that drives parliamentary engagement, coordinates cross-sectoral efforts, and provides oversight in the implementation of SRHR and HIV policies and programs. So that's it. Thank you.
Thank you very much, honorable member from Mauritius. I will have honorable member from Angola.
Muito obrigado, senhor presidente desta sessão. Tal como o presidente perguntou, eu também estou preocupada com aqueles países que têm elevados índices de HIV/SIDA e muitos nem assinaram nem ratificaram o protocolo. Eu gostaria de saber por quê. nós em Angola estamos muito preocupados com o HIV-Sida. Nós temos uma estratégia nacional de combate à doença, porque temos um desafio de até 2030 eliminar o HIV-Sida. Razão pela qual nós prestamos especial atenção a esta pandemia, mas ficamos preocupados porque temos países aí à volta que ainda não ratificaram nem assinaram. Eu queria saber do nosso preletor se sabe quais são as razões, e penso que, enquanto parlamentares, devemos ficar com esta preocupação de alertar os nossos países sobre a necessidade de todos nos engajarmos no combate a esta pandemia. Muito obrigado, Sr. Presidente.
Thank you very much, Honorable Member. We'll hand over to our resource person really to react to the interventions of honorable members. And I think it clearly really is a request from us to say, do you have any understanding of perhaps what are some of the bottlenecks that are preventing countries to step up in the ratification process and implementation that have been communicated to SADC Secretariat? Otherwise, if it's not known, then perhaps we discuss about mechanisms really for us to find out why the process is stalling. Thank you.
Thank you very much, Honorable Chair and Honorable Members of Parliament. The issue of ratification has been quite topical over the years. What normally has happened in the past is that the executive, through the president, will sign protocols or agreements or treaties, but then face the challenge of getting the documents ratified by the National Assembly or their cabinet. Broadly speaking, there is a fear that ratifications or signing of declarations may come with financial obligations to a large extent. This is not the main reason, and for purposes of moving forward in this meeting, I will just quickly, if you allow me some time over the break, to just get for each country specifics on why the ratification has not been done and where the stage is, so that we can help the members of Parliament. Thank you.
Thank you very much for that. I think it will be quite helpful really to just have an understanding so that members of Parliament, when they live here and they want to go advocate for the processes to speed up, having an understanding of what are some of the reservations and challenges will give them a sense of where to begin and how to approach the process. So it will be very valuable information for us to know that. Honorable members, if we don't have any further comments, I would suggest that our resource person passes on to the next protocol. Thank you.
Just sorry, Chair. I think I might have not included one or two other things in the health, but I'll mention them because the challenges are the same in terms of. I mentioned the declaration on HIV, the SADC framework of action for sustainable financing in health, then the SADC End TB Strategy 2025-2030, approved by ministers of health. Again, it is facing significant financial challenges in terms of implementation. There is the malaria initiative. This particular program is closed rather in March this year because of lack of funding. So So member states are urged to actively and financially support things like these initiatives, because depending on international cooperating partners, like we've seen with the change in policy by the US, this is no longer sustainable. We have the SADC pooled procurement services. This is an initiative where the community is being asked to utilize a centralized system of procuring of commodities. These are medical supplies, these are drugs, and the study that was done to check how much member states will be able to save just in terms of procurement concluded that this will enable member states to save about 60% of their resources. If we put, because there are those that are importing from Europe, there are those importing from India, there are those who are importing through agencies, there are those dealing with the suppliers directly. So this particular SADC pooled procurement services is intended to take advantage of economies of scale, dealing directly with the manufacturers, and this is likely to reduce the cost of procurement of medical supplies and commodities. We hope that because Council of Ministers approved this, we hope that member states will join. It has already been circulated to member states. We hope that they will join and participate in this particular program. So we talked about what recommendations we are putting in place to help this particular protocol. A suggestion from the Secretariat is to develop a regional health information management system and data sharing, because this is not in place at the moment. Member states have no idea what health systems exist in the community from their neighbors and those that belong to SADC. So there is a proposal that data sharing, this can be data sharing on disease burden, data sharing on epidemics and the strategies that are being implemented, so that you do not need to be calling meetings, for example, to discuss an epidemic. This people can get this information from online when you have a system that enables member states to log in and be able to check in that way. So this is an initiative that is developed and already approved by Council of Ministers. We hope that member states can participate. So briefly, those are the issues that, apart from the information I'll need to get from the office on specific member states, why the ratification has taken long, where the stage is, and see how member states can make use of that information as they engage their parliaments.
Thank you very much for that additional information. I don't know if honorable members have any reactions to that. Otherwise, we can just let you continue to the next protocol, which is the strategy for sexual reproductive health and rights, strategy of 2019-2030.
Thank you very much, Chair. The strategy for sexual reproductive health and rights for the region 2019-2030. Like I said earlier on, it helps to strengthen health systems and promote health cooperation amongst member states. The good news is that all member states are actively implementing different components of the strategy. And at the moment, the SADC Secretariat is conducting a midterm review to understand what the benefits that have accrued from this particular strategy, the lessons that can be learned, and any challenges that have been identified so they can be addressed as we implement the balance of the strategy from 2025 to 2030. This is a good strategy. However, because it does not fall into the category of protocols, so it is not legal binding on member states. So it has no legal force in short. So you can't hold member states against non-implementation of this strategy. Otherwise, the lack of legal force makes this strategy just like any other, which anybody can choose to implement or not. Again, it's another area where finance and human resource gaps exist. Coordination in terms of implementation, because it's just a strategy and member states are implementing components of it, not necessarily as a whole. So the recommendation is for member states, for members of parliament to advocate for it to have some legal status, so that its implementation can be followed through, and we can hold our executives or our governments accountable. Also, the lack of resources in financing this is an issue. So we hope that member states can allocate more resources in implementing this strategy. Chair, you heard in the meetings over the last 2 days that the issues of sexual reproductive health and rights are very important. We cannot ignore them. And I know that when the regional indicative strategic development plan was developed for 2020, 2030, these are some of the issues which were considered as special programs, and they did not fall under a specific pillar. Like we have the 3 pillars on infrastructure development, we have a pillar on market integration, we have a pillar on social and human development, but this particular one was under cross-cutting or special programs. So we are hoping that members of parliament can advocate for the transformation of this particular strategy into a protocol, where when signed, then member states will be made to implement, and there will be some legal backing for it. I submit. Thank you.
Thank you very much, our distinguished resource person. Honorable members, there we have it. The strategy on sexual reproductive health and rights, strategy of 2019 to 2030. Status, all SADC member states are actively implementing different components, whereas there are legal constraints, issues around sovereignty, financial and human resource gaps that still exist in different member states. There is fragmentation in coordination. The legal status itself, this being a strategy, having no, legal implications or any form of enforcement, remaining to be an issue. So I think this is a moment where you can have your inputs, any seeking of any clarifications, perhaps where you may not have understood, for our resource person to be able to expand more. But I think really the information is very concise and very clear in terms of where things stand as far as this strategy is concerned. I will open the floor for honorable members that may feel they have some submissions to put forth. Otherwise, we will move on to the next protocol. As members perhaps are thinking about this, I really noted down something that I feel is very critical that you mentioned on the advocating for a better legal status. And if I heard you well, you talked about perhaps finding a way to convert the strategy into protocol such that it will have that, legal status to be binding once countries are able to sign to it, to ratify. But overall, this is a strategy that seems to be an agency for every country. It is really hard for me to see why countries would have reservations, except this issue of financial. The financial implications and financial burdens, resource mobilization, it keeps being the reason why certain things that have critical importance fail to progress. And I really think it is important that our region comes up with a very, very clear and urgent strategy on how do we resolve this issue of resource mobilization. Because I don't believe there is any country that can stand here and feel like any component of this strategy somehow is questioning its ability to be autonomous as a state. But at the end of the day, it is the fear of will we be able to meet our obligations if we commit to this. But the other thing I guess that may be important for us to understand is once a protocol is there, it's signed, it's ratified, and there is an understanding that we know some components of it definitely are going to need resources, financial, human resources. The fear that member states have, is it because once they do the signing, they ratify, regardless of the shortcomings in terms of resources that they have, are there any punitive actions that, okay, you signed, you ratified, but we don't see you implementing this, even though we know the reason why you're not implementing is because you don't have resources, but the ambition is there as a nation? Because sometimes I believe resources will come being attracted by the ambition. Some resources get attracted by your vision. So if you don't ratify, you don't sign, it sends a message that perhaps you don't see this as a priority. But once you sign, you commit yourself, then it becomes easier, even through domestic mechanisms, to find a way to mobilize resources for this commitment you have already made. But if you have not committed to it, then I believe prioritizing, mobilizing resources for something you have not committed, it's another thing that creates a gap and slows down some of these progresses. So I just wanted to know the implication of signing and ratifying that now instills this fear in member states that, I better wait until I know I'm ready. Is there anything that really would be punitive to them if they show the ambition by signing and ratifying, as much as they don't know yet where they will get resources to implement? Perhaps that's another conversation that we can have as an open discussion, maybe. Because really, I feel like financial resources being put in the forefront of communicating your ambition as the member states being part of a region should really not, we should find a way to have it not communicate different messages. We should have countries saying, yes, we really want this to happen. They should sign for it, knowing that after signing, even if I'm not able to implement yet, there may not be any consequences. Even if I ratified and said, I would want to get this happening, if I have not figured out where the resources will come from, there will not be any punishment, so that we see who is on board as far as agreeing to this agenda. And then we work on how then do we help those who are left behind because of limitation of resources to implement, then have a solution to that. Because now we don't know, if you didn't sign, are we going to be able to get the solution for you? Maybe you don't want this thing. Maybe you don't agree to the protocol. So that's just something that I wanted to put out there. Thank you. If other members don't have any, I see honorable member from Mozambique wants to have an intervention, and then perhaps then you can take the honorable member from Angola as well would like to come forth. Yeah.
Muito obrigada, senhora presidente. E primeiro saudar aqui ao nosso preletor pelos conteúdos que foi nos transmitido ao longo desta manhã. Eu não tenho um comentário relacionado com o tema, mas queria apenas sugerir, porque os documentos vêm em língua inglesa e às vezes recebemos aqui. Queria sugerir que as próximas vezes pudessem ter uma tradução, a gente ler e confrontar os nossos ministérios para termos uma informação exata para podermos debater aqui com precisão, porque às vezes não sabemos o porquê da não ratificação de protocolos. O governo tem explicação que possa nos dar, mas precisamos de ter o documento e depois procurarmos saber junto aos nossos ministérios. Às vezes ficamos mudos, porque às vezes não temos uma matéria exausta para poder discutir. E é grave falar de uma coisa sem muita precisão. Muito obrigada.
Thank you very much, honorable member. We truly need to attend to that. My assumption is always that any documents that are being shared to us get translated. I'm not sure if perhaps there are any oversights on that, especially for documents that come from our resource persons. So I think committee secretary will have that noted just to check if this information, but I don't think it was previously shared, right? So it means definitely her point is valid. Normally when we have resource persons, we should request that they have their presentations shared earlier and then translated so that honorable members with a different language, they are able also to follow through in the language that will make them comfortable. Yes, there is translation when presentation is happening, but there is so much from just understanding what's written that's not being said that can help you actually to have your own contribution. So I do agree to that we should find a way to support them, that the resource person materials also should be translated in the languages they're comfortable with. Honorable member from Angola.
Obrigada, senhor presidente, muito obrigado. Agradecemos também ao nosso preletor pelas informações que foram disponibilizadas. Nós estamos perante uma estratégia muito importante, mas também desafiante, pois ele exige respostas multissetoriais. Mas eu gostaria de saber se todas essas estratégias, nos falou aqui do HIV, da tuberculose, e agora esta sobre saúde sexual reprodutiva, se estão centradas nas pessoas ou nas doenças. Porque a mim parece que nós devemos apostar na prevenção. A prevenção é um fator importante e nós devemos colocar as pessoas e as comunidades no centro dos serviços dos sistemas de saúde e capacitando até as pessoas a se autocuidarem, ao invés de serem apenas receptoras passivas da doença. Portanto, me parece que essas estratégias devem ser bem divulgadas para que, de facto, as comunidades possam perceber os objetivos dessas estratégias, que, como nós vimos aqui, e se as pessoas tiverem o conhecimento, eu acho que melhor podem cooperar com os sistemas de saúde. Preocupou-me também a questão que o presidente já levantou, se é uma questão legal ou não é legal, depende do que é que os países pensam. Eu penso que na região nós devíamos ter uma estratégia de atuação comum. porque nós temos fronteiras muito tênues entre um país e outro, e eu posso no meu país ter um sistema de saúde forte, o outro pode ter um sistema de saúde mais frágil, e como a fronteira é tênue, as doenças vão passando de um lado para o outro. Então, eu acho que temos que ter uma estratégia sólida e segura para podermos avançar. Muito obrigado.
Thank you very much, Honorable Member. Our resource persons, the floor is yours for the reactions. Thank you.
Thank you very much. Starting with the honorable member from Mozambique. We regret that the presentations were not translated and shared with them using a different language. I think this omission, like Shah, you've mentioned, needs to be remedied so that we can get their full participation. The strategies and frameworks that have been referred to in my presentation, I cannot agree anymore with the member of parliament from Angola. Yes, they need to be people-centered, and they must carry more of prevention, and the rest, like curative and others, can just be like supporting where prevention doesn't happen. In developing these strategies, the Secretariat works with member states. These are not documents that are developed by the Secretariat. We depend on the expertise, the experience, and the circumstances of member states in developing these documents. So whatever is reflected in these frameworks and strategies, we believe that they reflect the aspirations of the member states. However, where there are gaps, I think the honorable member of parliament is right. Where the gaps, we need to address them and put emphasis where it matters. From experience, I know that the members of parliament that on the side of the executive or belong to the party that is in power normally tend to have an advantage of having the information and participating in some of these. But unfortunately, for those that are on the other side of the aisle, sometimes this information is not shared with them, and it is the reason sometimes they tend to find such information in fora like this one. So maybe the proposal is for the SADC PF to ensure that the method of disseminating whatever information is within their purview is enhanced and communicated properly with the members of the forum. Otherwise, we appreciate the comment. Thank you.
Thank you very much, honorable members. I think now we have an opportunity to dive into the last protocol to review the status and the challenges that are being faced, looking also at the recommendations to remedy those challenges. And we are speaking about the SADC protocol on employment and labor. And this really is of quite critical interest, I guess, for many African countries as far as regional integration is concerned. These are things that we have been aspiring to as the community, to have members of the community be able to move in between countries for the purpose of labor, purpose of employment, purpose of trade, all these kind of things. So it is really important to see what level of interest our member states have to this. The protocol being new, perhaps the progress may not necessarily be that much, but it's important really to have an understanding of where things stand at the moment. Thank you, Honorable Resource Person. The floor is yours.
Thank you, Honorable Chairperson. The SADC Protocol on Employment and Labor, like you have mentioned, excuse me, is new. It is not yet in force because we are waiting for 2/3 of the member states, which is 11 member states, who are required to ratify it. Like I said earlier, the benefits that will come with this one are very interesting. Issues of workers' rights, issues of decent work, issues of discrimination, issues of labor migration are important things which are being addressed in this particular protocol. In terms of countries that have signed, you have Angola, Botswana, Eswatini, Madagascar, Malawi, Mozambique, Namibia, Tanzania, and Zimbabwe. These countries have signed, and none has ratified. So there is quite some work to do on this particular protocol. Not too sure, Chair, what else we can put apart from just asking members of Parliament what they think in terms of their role to ensure that this particular protocol comes into force.
Thank you very much, our distinguished resource persons. Definitely, with this protocol being quite new, it would be expected that not much has been achieved with it yet. But yeah, we'll open up for members really to have their reactions to this. I had the initial reaction when you opened up the countries that have signed and not seen Lesotho there. I was shocked because, we are likely to be the immediate beneficiaries of this, given our geographical location. So I had a feeling that we would have to have been the first to jump to signing it because of what it would mean for our people, being a country that is entirely landlocked in South Africa, knowing very well that we have a lot more of our people moving to South Africa in search of jobs, really having this kind of protocol that then talks about how do we facilitate employment between member states, movement of people, which you did mention that it's also being taken at a higher stage, would have been an interesting thing. So I have just questions in my mind, perhaps to say, why are we reserving our interest into this protocol? Yeah, it's new. I do understand that, but if some countries have already been able to interact with it to a point where they have signed, it means it is not the matter of time. It's really the matter of how committed are you to really get this regional integration issue become a reality as a member state. Honorable members, we have it here. Let us bring in our views onto this. I think the session that we have for tomorrow is the one that speaks specifically about strategies that members of parliament can then implement in trying to fast track these processes of ratification, domestication, and everything. We'll talk about that, but it's okay if any member would come up with the same comments at this point in time. And if I look at our agenda properly, finishing this part of work would mean we are done for the day. We had an opportunity really to just pull over things that had to be done tomorrow and just decide to finish them today. But logistically, it may not be quite possible, given that there are some things that really have already been organized to happen tomorrow. So it is really not possible for us to pull back agenda for tomorrow. So we'll have to come back tomorrow to finish up the remaining agenda items, which, looking at them, will likely take very little time. So we may end up finishing our meeting quite early tomorrow. So, Honorable Member from Angola, I realize that you would want to intervene. Please have the floor.
Obrigado, presidente. Mais uma vez agradeço por me conceder a palavra e agradecemos também ao nosso preletor. Eu queria partilhar convosco alguma informação sobre este protocolo. Como disse bem o nosso preletor, Angola assinou a 17 de agosto de 2023, mas a Assembleia Nacional já aprovou a adesão a este protocolo no dia 23 de janeiro de 2025. Estamos agora no processo de concluir os procedimentos necessários para o depósito do protocolo junto da SADC. É para tranquilizar o nosso preleitor que Angola já aprovou por via de uma resolução 6/25. Era esta a informação, presidente, que eu queria partilhar com os estimados membros. Muito obrigado.
Thank you very much, Honorable Member from Angola. Honorable members, if we don't have any further comments or further interventions, I think this then brings us to the end of the agenda for the day. Our time is roughly 12:30, so meaning we have some few minutes before lunch. So I think, yeah, we'll adjourn our meeting here and meet again tomorrow at 9 a.m., where then we'll be finishing up the last agenda of our meeting. And I hope we will try by all means to cover as much as possible within the shortest time tomorrow. And then all our members can have their Friday available to them. We have had a very long week, by the way, since Sunday. So it would not be a bad idea to really have some few hours to ourselves before we travel back. With this said, honorable members, if there is not anything left, I would really call the meeting today to an end. Let's meet again tomorrow at 9 a.m. Thank you very much.